Hi, welcome to Medex Physiotherapy Clinic. I am Dr. Dinesh. I am speaking about today about the IVDP, intervertebral disc prolapse. The commonly people they say about the slip disc, sciatica, so many words. But people must aware about what is slip disc, how we can treat, and how we can manage. The first thing I am going to explain about how this happens to the people who suffer back pain. The slip disc is our IVDP. The slip disc is a general term and the IVDP is the medical term, and the sciatica is the compression of sciatic nerve after followed by the disc bulge. The disc bulge takes place the people who sit longer hours and the people have a lot of forward bending work and who are having abnormal posture habits, and basically we can call it as a lifestyle disease. And what are the symptoms of a disc bulge? The first most important is a lower back pain, and some people they doesn't have the lower back pain, but they have a pain in the leg or the thigh or in the foot. And the generally the people they having a severe pain. The nature of pain is a radiating pain and swelling in the leg, and they have a pain in the back, and some people experience even unable to sit, stand or walk. These are the basic problems takes place in the slip disc. The slip disc, how we can diagnose? The person is having a disc bulge, there might be go to physiotherapist or a orthopedician or a neurologist or a general physician. What they do after a slip disc? And first of all, I want to explain what you can do in a home for the primary remedy before going a doctor or to consult any physician. What and all you can do to manage the pain in your home. The first most important to reduce the pain, everyone they do one wrong thing. They are applying a hot water fermentation. The hot water fermentation it increases the pain, followed by the hot fermentation. Why? Because it's a superficial heat. When you apply the superficial heat, it reduces the pain for a short term period, followed by the accumulation of excess blood in the area. It increases the pressure on the tissue, and that aggravates the pain. So don't give any hard fermentation if you have any back pain or any sciatic symptoms. The first most important first aid what you can do, the first thing is cryotherapy. Cryotherapy nothing but ice packs. You have to keep the ice packs over the region for 5 to 10 minutes every hourly. Do not keep an ice pack continuously more than 5 minutes, 5 to 10 minutes. What will happen if you keep more than 10 minutes? If you keep more than 10 minutes, it goes for decreased blood supply to the area, and it will lead to the aggravate the again pain. So the ideal time to keep the ice pack is 5 to 10 minutes, and you have to give a 1 hour interval. Then again you have to give 5 to 10 minutes ice packs. So the best modality to reduce the pain in the sciatica or the disc bulge is the ice pack. Is called as cryotherapy. Is one of there is some 10 to 15,000 researchers. They say the first modality to reduce the pain is ice pack, and followed by you can take some analgesics, whatever you can go for a paracetamol, any 500 to 650 mg, that will reduce the pain. There's one more home remedy you can do in your home. The followed by you can go to some physician or a doctor. You can go and consult. And what are do's and don'ts after a disc bulge? If you have any back pain or the sciatic symptoms, you should not do any bending activities or twisting activities and sitting on a floor and climbing more. These are all activities you must not do. That is, you don't do these activities. And what you can do, that is, you can do what are other activity to reduce the pain. You have to stay complete bed rest, and you can to avoid the twisting and bending activity, you can wear any lumbar belt, LS belt. We can call it as a lumbosacral belt to protect that area. So this will reduce the pain. See, these things you can do it in a home. Then followed by you have to go to a doctor and you consult a physician or a physiotherapist, and then they will do further investigation like X-ray, MRI, and those things. Then they will consider, they will confirm your disc bulge, what is the grade of bulge, either it is a only light bulge or herniated bulge, or it is a extreme bulge, it's called a sequestra. These are we can find out through investigation through MRI. But what are the other causes, other related causes for the back pain? When it comes to medical term, we can call it as back pain, maybe internal or external. What is internal and what is external factors? The internal factors, basically we can call it as obesity or bad posture or any forward bending activities. These all, any excessive kyphosis, excessive scoliosis, these are all called as internal factors. What is external factor? External factor means in a person having a one short limb, one leg will be lengthier, one leg will be shorter. That is what as we can call it as a limb length discrepancy. One is the limb length discrepancy. These are for external factors. Even the person having a flat foot, even flat foot also will cause the back pain. That is also we can call it as an external factor. And these are the factors we have to consider when we're treating a IVDP or a disc bulge. This is very important when we see about the spinal problems or the disc bulge. And we have for initial statement that everyone is concentrating on disc bulge and nobody concentrate on the cause of the bulge. And everyone worried about the disc bulge and nobody worried about the cause of the bulge. Then first thing what we have to do, we have to treat the symptom and we have to treat the cause rather than the disease. How we can treat the cause? The first most important, if a person is having a back pain, we have to give a first short wave diathermy, followed by, if it is severe low back pain, should not give any lumbar traction. The lumbar traction will aggravate the back pain, so that aggravate the back pain and it worsen, so should not go for a lumbar traction. If you have a severe back pain, then go for a cervical traction. The cervical traction relieves the back pain, and followed by can go for ultrasound and attends, and followed by the cryotherapy at the end of the treatment. So give advice for bed rest for at least 2 to 3 days, then automatically patient back to his work. Then we have to consider the factors that cause the disc bulge, like flat foot, TFL tightness, or iliopsoas tightness, either scoliosis, kyphosis. These are factors we can analyze and to correct. So automatically whatever the bulges come out, that will retract and patient will be happy and return to normal. This I want to tell, and please subscribe our channel Medex Physiotherapy, and please encourage to us. Thank you.